Good afternoon. I apologize. We are a little bit late. I know we said we'd be here too, so I apologize for that. We just had a little, I don't know what it was from the House. They didn't show up over here.
We're running on Senate time.
So we wanted to just talk briefly about the Health and Human Services budget agreement that we've reached. My understanding is the bill has not yet been posted, but it will be shortly. I'm not sure exactly the timing of that, but we thought we'd give a little chance to give you a brief overview and ask any questions. I do want to recognize, first of all, that we had we think, a very good working relationship with the commissioners and their staffs. It was a process that stretched out, actually beginning before we reached the final deal. We had a number of meetings, and we think that we had built the base by that time for what turned out to be, we think, a good agreement. Just a couple of things. What this budget does is it spends about $11.3 billion. That is a 11.6% increase in spending over current levels. And that's an 8.4% decrease from the forecasted levels. So in terms of dollars, it's a little over $1 billion more in spending than what the current budget spends. And we've done a number of things from the standpoint of reforms that we think have been, we have worked on in the legislature, and frankly, in discussions with the commissioners, they had also had thoughts about how to do this. We were very much interested in trying to change the growth curve for Health and Human Services. Over the past, well, since I've been here in the legislature, the HHS budget has almost doubled in size in terms of dollars. The average growth, if you look at the forecasts over that period of time, was about 15% forecasted growth every cycle. And what we've accomplished with some of the additional money that we took into this budget, the one-time money that came from the bonding and that we agreed to take in the budget as part of the deal, we've used that to create reforms that have changed the expected growth in the next forecast to be less than 5%. And we think that is very significant. Everyone has talked about the need to try to control and manage the growth in spending. We think we put reforms in this budget that would accomplish that. And I do want to turn it over to my colleagues in the House, Chairman Abeler and Chairman Gottwalt, who maybe can talk a little bit about some of the specific reforms.
Well, thanks. He always looks better than me anyway, so I just
we have rules about that.
Yielded to the Senate dress here. Anyway, we spent a lot of hours in this very room with the commissioner and their staff, and it's amazing how large of a crowd you can accumulate. Remember in the governor's office we had, the whole table was full, and then 4 rows of people and staff. And this is a very important topic. It has a lot of important issues in it. What we saw is that we have to keep it sustainable, and we have to, in the face of what is an unsustainable track that it was on. As Senator Hann mentioned, we cut the spending in about half, and the future spending by half again, which is remarkable in the face of an agreement and work input with the governor and the department that they are going to call a very reasonable resolution to this challenging problem we have. We talked about health reform in our first run at it. The health reforms by HMO management, reducing readmissions and so on, are in the range of 13% reduction off of the forecast in that single area. I was hoping for 10. And the department really dug in. We pushed them and worked together and found ways to actually bend the cost curve for real. And so the expenditures in this area are going to be actually less than current with the same or better results, which is simply remarkable. In the disability services, we're going to manage those a little more closely. There's assessment and reassessment in the bill, which is going to mean that we're going to make sure people wind up in the right place and that they're allowed to have more independence as they get, as they actually are encouraged to have a little better life. And there's so many stories about that, that it's really exciting about that. The county reforms are now allowed to be having a lot about, they'll be given a lot about flexibility and autonomy through the Service Delivery Authority, which was adopted. We carried that through. Representative Thiessen worked on it a couple years ago. We collaborated. We added to that. And the counties will have more flexibility to serve the people that they care so much about. The provider tax will be repealed in 2019. This sick tax has been a bipartisan bane. While it had some benefits, it targeted the very exactly wrong population. Mayo Clinic, I think, spends $60 million a year on this item alone. This will help our competitiveness for small business, and we're very excited about that. In long-term care, there's no nursing home rate cuts, which is proposed in the other proposals, and we were able to find a way to actually increase the rates for the lowest 18%, the lowest of the low nursing home rates, and we're very excited about that. I think there's some 60 nursing homes. The rural pharmacies that have been struggling with all these rate cuts in pharmacy reimbursement that serve nursing homes and others are getting a 4% rate increase. This has been an issue for several years and a bipartisan concern. I'm glad we can deal with that. We talked about choice waivers and global waivers. This bill has multiple waivers, and I think there's no less than 10 in areas of health care, long-term care, disability services, flexibility for our state, so well deserved. The Healthcare Access Commission is repealed. We actually have two good committees. We have a governor. Some of these commissions had a time that they made a benefit, but that one has been productive, and now it's time to move on to other ways. There's some mild general assistance reform about who can get it, and the sober houses, the wet houses, now have to encourage a policy of sobriety, which we think is an important reform. There are many, many reforms, and I won't go through those much now. There are some provider rate cuts in the range of 1% to 3%, which we kept those as modest as they could be so we could preserve access. There are no surcharges and no tax increases. And so we believe we have accomplished with the governor, who is, just have to say as an aside, was the most of a gentleman in dealing with us. And in his rapport with us and the commissioner with her department and the budget staff, MMB when they came in, the Department of Health, it was the most collegial atmosphere toward negotiating I think people have ever seen. I think we built trust over the months that we had to talk. And I think it's an example of how a good dialogue can go between the executive branch, and so I'm pleased with our product.
Can I just I apologize. I do have to leave, and I didn't want to run out with people wondering why I'm leaving the room. But I do have another meeting I have to go to. So if I could ask you folks to continue with the meeting, but I don't mean to abandon you, but I do have to.
Thank you. Thanks. Yeah.
Thanks.
Thanks. You have any comments you want to add?
The only thing that I would add is, the reason we are bending the cost curve, we're bending it by half from forecast in the first biennium. We're bending it by half again in the out years. Many times we're accused of kicking the can down the road. That is clearly what we are not doing in this budget solution. We are actually bending the curve. We're not bending it just for dollars' sake. We're bending it for Minnesotans' sake. By putting ourselves on a more sustainable path, we will be able to keep the promises we're making to the people who need us to keep those promises. I mean, that is the ultimate reason that we are doing these reforms, bending the cost curve, not imposing new surtaxes, not imposing new penalties on nursing homes, using the additional dollars that we got out of this deal to help preserve eligibility and care for the people most in need. This is historic. The path that we are putting Health and Human Services spending on right now is historic. This state has never done this before. And again, it is not for the sake of the bottom line, it is for the sake of Minnesotans. I would mention one of the things that didn't get listed is one I'm particularly proud of, and that's the Healthy Minnesota Contribution Program, which privatizes a portion of the Minnesota Care Program, specifically adults without children above 200% of the federal poverty guideline. These are typically the working poor. These are people who don't have health care coverage primarily because they don't have the money, not because they don't have the ability or the wherewithal to purchase their own coverage, but because they don't have the resources. The state will be taking a new role with these people to give them some money to help them purchase private coverage like the rest of Minnesotans. We think that's a significant reform. We believe it's the first of its kind in the country. We're doing it for about 8,000 Minnesotans. And we believe it will show tremendous results and really kind of model where we need to go with healthcare reform long term in terms of the state's role in helping people in need.
So we'll stand for questions.
To what extent does this represent the loss of eligibility for existing programs, either Medicaid or Minnesota Care?
Eligibility is fully intact, which is remarkable.
Did you ever think you'd be walking out of here with this bill?
Oh, I knew I would, I just didn't know when.
Does the tobacco ban bonds are not included in this bill, and do the tobacco bonds not go into the healthcare access fund?
I don't know. The tobacco bonds are not in this bill.
Okay.
I think they're tobacco bonds, if I remember the discussion. But
We'd need to ask our tobacco bonds people. Say that 5 times fast.
I'm sorry, we don't know that.
What has become of the Lutheran Social Services My Life, My Choices program? The idea that people who are disabled would have more control of their lives.
The House and the Senate were very fond of that all along, and we offered it until the end. The department felt that those were covered in the waiver requests we were doing and wanted to do it as more part of a package. And so the intent is in there, the spirit of them is there. It may be that we need to revisit some of the details that aren't going to be covered in those, but that's where it is now. So it's.
We want to do those reforms very much, and in the negotiations they ended up not getting done this time around, but we want to do that.
Reform is obviously the key word. Everybody's been saying reform, reform. You called it historic. Can you quantify why it's historic? What makes it historic?
Yeah, well, I mentioned, if you've been listening to any of my hearings, and if you weren't there, I don't know why you didn't come. We had some seats, although they were often full. But the whole issue is about health costs. Minnesota is always a leader in health care and in innovative ways and in quality of life. We're at the top of the list on longevity and actually caring about people who need our services. But even in Minnesota, we can still bend the curve lower. And I was hoping at the end to come and tell you I had saved 10% in the Minnesota state programs and in medical assistance. But actually the savings in this bill are even more than the 13% because of some rate cuts, and that. Rate cuts aren't reform. Changing how we do business is reform. And so we're paying our providers through the HMOs some 13% less. Through the reforms the department and us put together, with readmission bonuses, pregnancy changes. The governor had a proposal about some of the childbirth, pregnancy things. Didn't go as far as I was hoping, but it was a good start. Emergency room use, keeping on pushing the healthcare homes, and in competitive bidding, and in pushing the plans to negotiate better with their providers. One of the provisions I was hoping to get in was this, some of the choice waiver language. Specifically, I've been working on with hospitals and health plans. But I was told by one of the providers that in the last 2 months, they've never had such a dialogue with their health plan about negotiating and in service planning and coordination. So even without a law, we've accomplished pushing the plans and the providers and the clinics to be more collaborative and more focused on the outcome. That is a true change in culture.
So how does that trickle down to the average consumer or patient, would you say? What changes will they notice?
The change that they're going to notice over time and where the reforms really take us is, Representative Abeler in particular has worked a lot on this idea of flexibility. So reducing the cost but allowing for more flexibility so we can do a Minnesota approach to care that we know works best. Can the dollars follow the right way to deliver care? We've begun doing that in this bill. Bending the spending curve is not just about dollars again. It's about creating sustainability so we can continue to keep the promises to the people who need us to keep them, and that is a vitally important reform. Elsewhere in the country, we've seen states focus on eligibility and getting more people into government programs without consideration of the finances, and they've ended up hurting themselves badly in terms of sustainability for those programs. We're taking a balanced approach. We're not only reforming how we deliver care, but we're reforming that cost curve so we can continue doing this for the people who need us to keep those promises.
How many pages is this bill?
I don't know.
I've heard 900 or something like that.
Oh no, it'll be a couple hundred.
No.
Okay.
I don't think it'll be as long as the original ones. We
Watch
didn't do
and
all
see it
the,
online.
We didn't do all the
Is it-
policy.
Is it fair to
Yes.
is it fair to other legislators and the public to have a vote on this? It's not even posted yet, I don't think.
It's not made of lots of new things, let's put it that way. What you will see, this was built off of the conference committee report and positions that the governor was already making apparent. So these are not dramatically new things that will be seen in the bill, but they do represent the results of legitimate negotiations between the governor and the legislative leadership.
Would you go so far as to say it is a better bill than the one that left the House and Senate floors a couple months ago?
It's better than any of the three. It took the best of all. And I think this is an example of how government should work and how good ideas should be feathered in. And I can't overemphasize the collegiality and the momentum the department had toward trying to really do something new. And I credit that to the the governor in appointing Commissioner Jessen, who comes in with a history in health law and all, and a desire to do something different and to truly make a difference. And I think that set the tone. I think our collegiality and our Senator Hann and I, Representative Gottwalt, with our different expertises and skills, really worked well together. I think when people get to read the language, they'll go like, well, how did they ever do this?
Would you say this is consistent with and in keeping with the track that the state set for itself in '08 with that first major health reform bill?
Yes, I think it builds on those reforms. Healthcare homes, provider incentives, and then we added competitive bidding and other more specific things that have evolved. And so we didn't repeal anything of those reforms. I don't think anything got repealed of those, and we in fact built on them.
What's the status of some of the language about federal health care law, the MA expansion, I mean, some of the treatment of those kinds of things that were obviously kind of something to aim at more earlier in the session?
Well, I think that part of the global agreement was that would be allowed to go, the expansion would be allowed to go forward, and some 16,000 people are now covered in Minnesota because of that addition, and we accepted that, and then we found ways to how to serve them better in the system. Part of our objection was not to serving the 16,000 people, but into continuing to fund a system that churns and has no reason to control costs, and in fact make things more unsustainable. And it gave us the addition of that actually gave us a joint interest in finding ways to make it affordable so we could actually keep them in.
What about the abortion provisions and the human cloning ban language?
Well, the human cloning language, as I understand, is in the higher education bill.
Well, it was here too. It was in our conference report.
It was in our conference report as well. Well, as you know, I mean, the governor's list that got us to the negotiating table to get a budget resolution to end the shutdown included those provisions. Obviously, our caucus fought hard for pro-life positions. We always have, we always will, but in a spirit of compromise and in a spirit of trying to get a budget done so we could get Minnesota back to work, we were willing to forego that.
The abortion and the cloning were taken out?
That's correct.
Does this bill have money for a healthcare exchange?
Excuse me.
Short answer.
Well, good. I'm thinking through my head whether the budget has a line item for it. There is no prohibition against the use of federal money for moving forward on reforms. There is nothing explicitly in there for an insurance exchange.
With the change that you're making with regard to some portion of the Minnesota Care population, and with the repeal eventually of the provider tax, what's the future of Minnesota Care that you envision after passing this bill?
It will become less and less necessary because when in 2014 we cover up to the 133% level of poverty, and there's expected to be quite a large surplus. And the provider tax repeal is actually, as there's a surplus in the future, it will blink down to satiate the need for programming in there. And then in 2019, it'll be a full repeal as of the end of the year. We expect that it's going to be, that those programs as necessary will be fully funded and adequately served. And if not, then the legislature in 2018 will have to talk about that. But we think that given the now over 20-year effort to repeal it and the regressivity and the fact that somebody who has cancer is going to be paying far more than somebody who doesn't to fund health care for people with low incomes doesn't make any sense. And many doctors who don't see any medical assistance people are charged 2% of their entire book of business but Medicare and the state programs. That it made sense at the time. And I think what you can say of the whole Minnesota Care medical assistance program is that we've moved it to the next iteration with respect to the value of it, and now how do you rejigger it all to make it a bit more affordable. So it's like when you clean out your fridge. So we did that with the healthcare system and found ourselves saving 13% more space. Ooh, how'd that get in here? Ooh, eggs.
At the beginning of the press conference, Senator Hann said that we are going to be spending in this bill 11.6% increase over current levels. Do those levels include the federal stimulus money that was used to take over Minnesota's customary share of medical assistance? That's
working off the base, including that. So the base, including that, was, I think, $10.2 billion. I think there's an $8.7 billion number, which does not include the stimulus and extra money.
Can I ask a question as a citizen?
Are you a journalist?
And it's probably, doesn't necessarily be directed to the two of you because you weren't the ones making this decision. But it does bother me that when decisions were being made in this building that literally affected the lives of millions of Minnesotans, for better or for worse, there were concrete barriers in the driveways going into the building. There was yellow, what looked like police tape wrapped through the doors, the closed signs, security posted, if anybody did find an open door, security posted to make sure that no ordinary citizens would have any ability to even get into the building, much less have an impact on the decisions getting made. And again, I'm not faulting the two of you, but it's an important question that ought to get addressed somehow, that we ended up in a situation where I think is absolutely unprecedented, and as a citizen, I hope never, ever happens again.
Well, we agree, and I think we'll just accept your citizen statement. And thank you for your statement. Anybody else? I appreciate your attention, and if questions come up, we'll be available. Thank you.
Thank you.